This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
Welcome to Africa's Health in Focus, coming to you from the Health Broadcasting Service HBS radio live channel. In today's program, we will be making Central African Republic, CAR, our focal point. The Central African Republic is a landlocked country in the central part of Africa. Its border to the north is Chad, Sudan to the northeast, South Sudan to the southeast, the Democratic Republic of Congo to the south, the Republic of the Congo to the southwest, and Cameroon to the west. The African Development Bank defines the central part of Africa as including Cameroon, the Central African Republic, Chad, the Democratic Republic of the Congo, Equatorial Guinea, and Gabon. History records that from the 1880s onwards, Central Africa had been colonized by the Spanish, French, German, Belgian, and Portuguese powers. Africans, sad to say, generally suffered a harsher kind of rule in the central regions than in West Africa, as colonialism brought little capital and investments, and imposed brutal forms of extractive economy. Central Africa, regardless, continues to be rich in natural resources and still has the second largest tropical forest area in the world. The Central African Republic particularly is naturally endowed. Timber and diamonds dominate exports. Logistical planning, transportation, and other electrical infrastructure are unfortunately extremely limited. CAR continues to be an important source of raw materials, such as wood and oil for many industrialized countries in the EU. The Central African Republic is, as at the time of this report, still one of the world's least developed countries, with over 60% of its population living in abject poverty despite its natural resources. We will shift our focus on healthcare in the Central African Republic. Healthcare in the Central African Republic. Healthcare of young children in the Central African Republic have a relatively fairer deal than most parts of other African nations. CAR achieves 92.1% of the expected goal based on its current income as opposed to the 75.2% of what is expected for the adult population. Central African Republic, one of the poorest countries in the world, continues to grapple with numerous human capital challenges. It ranks near the very bottom of the United Nations Human Development Index of 188, out of 189 countries in 2020, which presents devastating consequences for its future generation. The health system in Central African Republic is barely functioning, due to a severe shortage of skilled health workers and medical supplies. Limited access to vaccination means that easily preventable diseases continue to take a huge toll. Malaria is the leading cause of death among children under 5 years of age. The Central African Republic has the second lowest life expectancy in the world at 48 years, and the fifth highest death rate from infectious and parasitic disease. In much of CAR, mortality rates are the result of seasonal epidemics, economic downturns, as well as conflict, displacement, and a poor health system. HIV, AIDS, influenza, pneumonia, and diarrheal diseases continue to be among the biggest causes of death within the CAR population. According to the World Health Organization, HIV/AIDS deaths in the Central African Republic account for 13% of total deaths in the country. The Central African Republic is one of the world's least developed countries, with over 60% of its population living in abject poverty. The health system in Central African Republic is barely functioning, due to a severe shortage of skilled health workers and medical supplies. Limited access to vaccination means that easily preventable diseases continue to take a toll. Malaria is the leading cause of death among children under 5 years of age. There has been a little, and far in between, progress in the last few years. Despite the progress, medical care is still both costly and inaccessible for many families across the Central African Republic. Vaccination rates for preventable diseases stand at less than 52%, and 1 child in 8 does not live past 5 years of age. Malaria, leprosy, tuberculosis, nutritional diseases, HIV/AIDS, and sexually transmitted diseases are major health concerns in the country. The number of cases of sleeping sickness is increasing. No modern healthcare facilities exist outside Bangui, which itself has only one major hospital, and for few other towns. Prior to civil unrest that erupted in late 2012, there were a number of hospitals and clinics that were staffed and run by missionaries who provided relatively good care to those who could reach them. For the majority of Central Africans, however, little is offered by the poorly equipped and insufficiently staffed maternity clinics, dispensaries, and first aid posts available to them in the countryside. Even the hospital in Bangui is currently below standard for minimal care, and few private clinics are available to the wealthy in the capital. The distribution of medicine is extremely difficult given the inadequate transportation system. All these issues were worsened with the instability that began in late 2012 and persisted in the following years, with few people having access to health care. Malaria, leprosy, tuberculosis, nutritional diseases, HIV/AIDS, and sexually transmitted diseases continue to be major health concerns in the country up to the time of this report. The number of cases of sleeping sickness is ever increasing. During times with a functioning government, welfare benefits, including unemployment and maternity benefits, childcare allowances, and social security, have been available to a small number of government and private sector employees in the urban centers, but majority of the population are forced to rely on their families and kinship networks, communities, and friends for what little help they can obtain. That is never enough to sustain any healthy lifestyle. The country faces a growing number of homeless youths in Bangui and in the other large urban areas. As at 2020, 52.2% of the entire CAR population were undernourished according to available data, and that has little changed, if not worse. Soaring cost of living and food prices have been taking their toll on the country. Extreme hunger is widespread. Needless to say, healthy living is not within the reach of the wider CAR population. So where do we go from here? International Medical Corps have supplied life-saving interventions to internally displaced people and refugees, but that is never enough in comparison to the size of the internal problem created by conflicts which continues to affect healthcare delivery in the Central African Republic. Violence against healthcare professionals in humanitarian settings and conflict situations continue to pose major challenges to charity organizations who stand in the gap supplying the much-needed healthcare interventions in nations affected by internal strife and wars. The World Bank in June 2022 approved $138 million grant to CAR to improve living conditions in the Central African Republic, financed by an $83 million grant from IDA, a $30 million grant from the Green Climate Fund, and $25 million in private financing for the Electricity Sector Strengthening and Access Project PARS, and $70 million in financing for the Health Service Delivery and Systems Strengthening Project Ceneplus, comprising a $58 million grant from IDA, and a $12 million grant from the Global Financing Facility for Women, Children, and Adolescents GFF to restore and protect essential health services amid multiple crises, including COVID-19. That is helping to bring some little relief. But for how long in the midst of much poverty? A long-lasting sustainable solution is required. This is all we have for you in this episode of Africa's Health in Focus. We will continue to update you on the progress in the Central African Republic and especially on their healthcare programs. Until next time, please stay safe and healthy. And bye for now.
This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.